The study by WellKnowMe, a health technology company, found that 8% of Nigerian employees have an increased risk for developing depression. This, according to the World Health Organization, makes Nigeria the country with the highest caseload of depression in Africa. It found that negative working environment may lead to physical and mental health problems, harmful use of substances or alcohol, absenteeism, and lost productivity.
If you look at two categories of people, there are those that already have a mental illness and are in our workplaces. The question is, what kind of support are they getting? Are we stigmatizing them? Are we giving them the space for them to feel comfortable to speak out and share what is happening to them so that they get the support they need?
Many of us sort of shy away from issues of mental health, but this is not something we can run away from. The fact that you don't acknowledge something doesn't mean that it does not exist. So it's even better to grab the bull by the horn and deal with the issues. We need to take away the stigma that is associated with this so that people that are challenged can come forward to get the help that they need.
From the workplace, the rising cases of mental health issues in Nigeria have been linked to factors such as poor economic conditions, rising cases of illiteracy, marriage crisis, polygamy, and large families. A major issue is that 85% of people who live with the condition have no access to treatment. According to the Association of Psychiatrists in Nigeria, there are fewer than 300 psychiatrists for an estimated population of 200 million people. In addition, psychiatrists and other mental health specialists are mainly available at tertiary healthcare centers. At the Yaba Hospital in Lagos, each doctor now attends to 50 to 80 patients per day.
We all have some form of mental issue. Some of us get angry unnecessarily. We are pissed off by little things. We get frustrated. We shout at our maybe workers. And when we talk about the workplace, we don't necessarily mean big conglomerates, big offices, and the rest. Even the home is a workplace where you have your drivers, your maids, your cooks. It's a workplace. So there's this need for us to bring to light, to bring to focus and sensitize the general public what mental well-being is all about.
A mental health bill, first presented to the National Assembly in 2003, has now been reintroduced by the National Policy for Mental Health Services Delivery. It sets out the principles for the delivery of care to people with mental, neurological, and substance abuse problems.
Advocates, psychiatrists, stakeholders are asking for our Mental Health Act. Last legislative period, it got to second reading, ended. Now they've done a second reading, and it's really about getting this bill to the office of the president. No one is championing it at the moment. Why? Why should a country like ours still be in this state? The framework, the legal framework that we are using for provision of mental health services is probably well over 60, 70 years old.
For now, experts say there is an urgent need for more investment on research and development, as well as an information center on current trends, areas of need, and unmet needs on mental health services. This, they say, will help in making informed decisions on policy directions and identify appropriate interventions. Benny Ock, Arise News.